You're welcome back again. This is your friend Nurse Pollution. Let's talk about obesity and men's sexual health. How are they connected? Obesity is one of the famous killers of our world, leading to over 1,000 deaths per day in United States of America. Its adverse effects do not only include heart attacks, high cholesterol, and blood pressure, but also takes toll on men's sexual health. Believe it or not, obesity affects men and women largely in their healthy sexual lifestyle. It specifically affects male hormone, sexuality, and prostate health. So in this video, let's learn more about how this killer lifestyle habitat can affect you and your sexual health. How to know if one is obese. To know if one is obese or not, the standard calculation of BMI is required. We call it the body mass index, which helps one identify if they are underweight, underweight or normal or nearly obese or obese. One can change their lifestyle according to their BMI into a much healthier one, which is suitable for their body and longevity. The BMI gives you an estimate of your overall body fat. A BMI between 25 and 30 puts you in the overweight category. Though body fat is good, abdominal fat is the more harmful variety if your waist circumference is above 37.5 inches. It puts you at risk of obesity. Obesity and testosterone is the major male hormone that helps give men their prominent features such as the voice and helps in the development of male reproductive organs for sperm production and of course libido. This hormone levels start to reduce as men grow older and older. The drop in the testosterone average just 1% a year, but obesity helps in accelerating this decline into testosterone deficiency. So a study has found that the waist circumference of men was the strongest predictor of developing symptoms of testosterone deficiency. So I want you to know that being overweight might also be a major hindrance to one's stamina, which is important to sustain a sexual performance. Obesity changes the metabolism of sex hormone and its impact can cause loss of libido or low sexual drive. Another study has found that 1 in 7 obese men could benefit from testosterone replacement. This just proved that obesity and testosterone levels are interlinked and interwoven with each other. But some of the factors that obesity can affect in men can include erectile deficiency. Men with erectile deficiency often blame testosterone and their hormonal disorder, but this only accounts for about 3% of erectile dysfunction. But even with normal testosterone level, men who are obese have an increased risk of erectile dysfunction. One Brazilian research also linked abdominal obesity to erectile dysfunction, but only in men over 60. Another study reported that having a BMI of 20 increased a man's odds of developing ED by over 90%. This can be improved by thorough diet and exercise without any medication. Men who lost the most weight enjoyed their greatest benefit, obesity and sexuality. Obesity sure takes a big toll on sexuality. It can also impair fertility. In research conducted by some American scientists, it has been found that obesity is linked to low sperm count and reduced sperm motility. This has been reported in men between the ages of 20 and 30. So it may make someone feel less confident about themselves and their lives, which result in poor performance. So in a recent study conducted among 1,000 respondents aged between 18 to 45, it has been found that poor self-image and lifestyle disorder were a common worry among obese people. Some of the other diseases that are linked with men's sexual health and obesity can be kidney stones. This painful deposit of calcium, oxalate, or uric acid can be most common in men who are obese. It can lead to benign prostate aplasia. It's the enlargement of prostate gland. And of course, a Chinese study has found that men with bigger bellies have bigger prostate gland, lower PSA level prostate specific antigen through the specific antigen. Though obesity enlarges the prostate gland, it also lowers the prostate specific antigen level. It is due to that obesity increases the blood volume and not because their prostate produce less. So PSA is more diluted in the blood. It can lead to prostate cancer because obesity lowers PSA levels. It can make it harder to detect prostate cancer in obese guys. Obesity also has an adverse effect on the biology of prostate gland, which shows that the extra body fat increases a man's risk of developing prostate cancer. So the alteration of the metabolism of sex hormone also affect the growth of prostate cancer. This further health complication of obesity linked with the sexual health of men can be fought by with healthy lifestyle changes and exercising with diet control and losing a few kilograms. Beating obesity is no big deal, though it is hard but not impossible. With sheer will and determination, it can be done with ease. So see you in the next video. Thank you.